Hello, this is Eddie, Black Bull Assets. Since the COVID-19 pandemic started a few years ago, the World Health Organization was almost at the point to declare a new threatening health emergency over monkeypox. The World Health Organization had organized an emergency committee in Geneva to talk about the new so-called epidemic that shows more than 3,000 known and confirmed cases until today. Some other media channels even speak of more than 3,500 cases since last week. In the committee, some expert would have the attention to advise the World Health Organization to declare this disease as an emergency of international public health. Monkeypox is not a new virus and it has as far not taken any lives outside the endemic countries as West and Central Africa. At the moment, Nigeria is experiencing the largest documented outbreak in West Africa. Monkeypox poses its greatest threat to pregnant women, young children and the people that are immune oppressed. According to the website of the CDC, it spreads by direct contact with the infectious rash, scabs or body fluids, respiratory secretions during prolonged face-to-face contact or during intimate physical contact such as kissing, cuddling and sex. It can also spread by touching items such as clothing and linens that previously had contact with the infectious rash or body fluids. Pregnant people can spread the virus to their fetus through the placenta. There is a possibility to get monkeypox from animals such as being bitten, scratched, eating or using products of an infected animal. People who do not have any symptoms of the disease cannot spread the virus to others. The CDC mentioned as well that it is not known yet if monkeypox could spread through semen or vaginal fluids. As for the latter, this might as far be true, but we all know that the pharmaceutical industry exists in first degree like any other business to make money and all other is related to that. So we can assume that as semen and vaginal fluids are also body fluids, we may expect that in a matter of time the disease will be spread through it. For the monkeypox disease, some tools are available. A polymer chain reaction, or just a PCR diagnostic test, already exists together with two vaccines that can be used to fight the disease. Both vaccines are against smallpox. The first is the ACAM or the ACAM 2000 vaccine that is manufactured by the Sanofi Pastuer Biologics company. This vaccine is not suitable for mass immunization as there is a danger to more serious adverse reactions. The second is the MVA-BN vaccine. The MVA-BN vaccine is a two-dose vaccine that is developed for smallpox and that seems to be effective against monkeypox. In the USA, this vaccine is known under the name Jynneos, and it is the only one that is specifically authorized by the US Food and Drug Administration for that use. Until now, the World Health Organization has no recommendation for a mass vaccination against monkeypox disease, but we have seen recently in the past few years that things can change rapidly when Big Pharma starts lobbying to make money out of their products. For now, the World Health Organization has said to use the MVA-BN vaccine to vaccinate healthcare workers that have close contacts with monkeypox patients. The manufacturer of the MVA-BN vaccine has its base in Denmark and is Bavarian Nordic. Bavarian Nordic is a relatively small vaccine manufacturer, what makes that the supplies of the vaccine are limited and production quantity is low compared to the orders, meaning that the existing production is disappearing rapidly. On June 14, a deal between the European Union and Bavarian Nordic was signed for the supply of more than 109,000 doses of MVA-BN vaccines, while the European Medicine Agency has not even authorized the vaccine as declared safe and usable against monkeypox. The United States have already a stock that reaches some 1.4 million doses, and they took an option to buy an additional 500,000 doses of this MVA-BN vaccines. France is already using the vaccine, knowing that the European Medicine Agency has not given its approval. The United Kingdom, Portugal, Spain and the home base of the company, Denmark, have announced to start buying the vaccine. Germany has a running order of 40,000 doses and took an option for 200,000 more. Canada just recently signed a contract to buy the vaccine for a value of more than $50 million and has to wait for delivery until 2023. Since the latest outbreak in May 2022, several cases of monkeypox were identified in non-endemic countries, creating fear in governments that reflected their fear to their citizens, what created the vaccine orders as I just mentioned. When we look at the stock of Bavarian Nordic, we can place some question marks on this matter. We see that on May 9 the stock price was on its lowest at about 115 Danish krones each. On the May 16 outbreak of monkeypox, we see the stock price starting to go up from about 130 Danish krones to a spike of about 222 Danish krones. That means a soaring stock price of 92%, while there is not a single fatal death case as far in non-endemic countries. What would this stock do when it would become indeed a new pandemic, as what the World Health Organization organized its emergency committee for? Let's take a look at Bavarian Nordic. The company was founded in 1994 and has its headquarters in Hellerup, Denmark. It is a fully integrated biotechnology company with a focus on the development, manufacturing and commercialization of vaccines for infectious diseases and cancer immunotherapies. They produce several products for different diseases. The product Imvanex against smallpox was approved for use in the EU since 2013. The product Imvamune, also against smallpox, was approved for use in Canada also since 2013. For the USA, they are manufacturing the product Jynneos, approved for use since 2019 and is against smallpox and monkeypox. As the orders for the vaccine came in, the stock price started to grow again. And then this is very interesting information. On June 16 of 2022, a new press release tells us that Bavarian Nordic provided an update on the phase 3 program for its COVID-19 booster vaccine candidate. This phase 3 trial of ABN-CoV2, a non-adjuvanted COVID-19 booster vaccine candidate, has been redesigned as comparator vaccine and has now come available, enabling a double-blind controlled study to demonstrate non-inferiority of ABN-CoV2 to a licensed mRNA vaccine. The fully sponsored trial will be initiated in August 2022 and subsequent approval in 2023. When we look at the annual report of 2021, we see a fairly high current ratio of 6.25 and a quick ratio of 2.49. This tells us that the company has no problems at all to pay its bills. Bavarian Nordic is a healthy company with good value and room for growth. The price-to-book ratio is way overvalued, but I have a strong belief that this overvaluation of the stock will start to lower in the next few days. Yesterday, on June 25, the World Health Organization said that the rapid spread of monkeypox across dozens of nations does not represent a global health emergency at this time. The World Health Organization's Director General described monkeypox as an evolving health threat according to the Philippine news agency. As the Director General speaks of evolving, this means that it can still change rapidly or slowly to a global health emergency. Keeping this in mind and knowing that the Bavarian Nordic update on their phase 3 program for its COVID-19 booster vaccine candidate, with data readout anticipated late 2022 and subsequent approval in 2023, could make the Bavarian Nordic stock very interesting to have in portfolio. As I expect a drop in its share price, it can be a nice opportunity. Please take note that none of my sayings are investing advice. It is only my view on how I believe that a stock will do, either in a short or in a long term. Always do your own due diligence. Hope you have enjoyed this video. If so, then subscribe to this channel and click on the notification bell below for upcoming new videos.